Welcome to Radiology in a Minute. I'm Sid Dogra, one of the Associate Editors of Radiology in Training. Today I'll be discussing a just-published paper on the performance of multimodal ChatGPT on text and image-based diagnostic radiology in training exam questions by Hayden et al. Several papers have now been published looking at the performance of large language models like OpenAI's GPT-4 on multiple-choice question sets, ranging from USMLE exams to radiology board-style questions. These studies have focused on text-only questions, as earlier releases of GPT were not able to answer image-based prompts. Starting in September 2023, a release of GPT-4 with Vision was able to process images, which immediately led to interest in its ability to interpret radiology images. The purpose of this study is to compare GPT-4's performance on text-only and image-based multiple-choice questions from radiology resident and training exams. Questions from the 2017 through 2019 in-training exams were used. After removing questions that were essentially repeats, 377 questions were used to assess performance. 195 were text-only, and 182 had images. These questions were fed to the ChatGPT application programming interface using a basic prompt that you can find in the study itself. Performance was compared across the full set of questions, but also after stratifying by subspecialty. Later, the authors fed questions again using 5 different prompts, which again can be found in the manuscript. Performance was significantly better on text-only questions compared to those with images, specifically 81.5% correct versus 47.8%. Genitourinary was the only specialty where GPT-4 performed better on questions with images. Chain of thought prompting, where the model was asked to think step by step before picking an answer, provided best overall performance, but notably this improvement was not present when looking at the image-based questions. For image-based questions, no two prompts significantly changed performance. Rather than necessarily focusing on the specific performance on a multiple-choice-based test, which does not mimic clinical practice, the key point is that GPT-4, even with the ability to process images, is unable to consistently and accurately interpret medical images regardless of prompt strategy. Although GPT-4's reasoning was not formally analyzed across all studies, the authors note instances where the correct answer choice was picked, but with an incorrect explanation or interpretation. Clearly, we remain a ways away from being able to use large language models for radiologic interpretation.